everyone. Thank you for coming. It's nice to have a small group too, so that we can interact a little more, and then of course hopefully there's some people on Zoom. So Russ, just let me know too as we go through if there are any questions over there or comments. So today I'm going to be talking about student evaluations, and we know of course that they are a necessary evil in terms of how we know students are getting what they need to get out of our courses. And the reason why I'm exploring this topic is because number one, I have found in my time in education so far that there are a lot of biases that can exist in course evaluation. And I'll talk about some of those and how we can maybe deal with those in a minute. But I also have come across a very innovative, I think, way of assessing students and learning within a course that is a little more objective and less subjective. And so I wanted to share that idea with the community here at Paris to see if you might be able to utilize something like this within your courses, labs, clinics, and so on. So my objectives for this presentation are to discuss a little bit about our current evaluation methods and of course some of the biases that can come with those, introduce the idea of a student knowledge survey as an alternative, and then provide some examples of how I use the survey in my own courses in hopes that it might lead you to your own ideas on that. I'd like to also talk a little bit about the data collection process, analysis, and sort of how I implemented this within my courses, and then propose a process for implementing this within your courses, and then take discussion and questions.
Can you stand a little bit closer to the mic?
Sure. Okay, is this better in terms of audio, Russ?
Let's see.
Okay, let me know. So to start with, I want to talk a little bit about how we evaluate courses now. And this is not an exhaustive list by any means, because we know that there are many ways we can evaluate our courses. But in terms of having a student complete an evaluation on us in some fashion, these are the primary ways that I believe Ferris is doing things now. So we have a university-wide system that we use. To my knowledge, the latest is the IDEA system, IDEA. I know we've used other methods at Ferris in the past. There's still some floating around that are in use, but this is the standardized assessment protocol from the university that's administered at the end of coursework. We also have the FCTL, Faculty Center for Teaching and Learning, Small Group Instructional Diagnosis Process, or SGID. And as you probably know, this is a process where FCTL will come into your course upon invitation and really talk to students in a small group format to figure out how you are doing with the course. How are you teaching? What do the students think? What could be improved, and so on. And then, of course, we have individualized course evaluations by instructor. So I know at least within optometry, many of our faculty have our own evaluations as well. And we do these for different reasons, perhaps than the university does them, but we still have a kind of customized evaluation that we might use within our course. So again, not an exhaustive list. There are many other methods, but these are a few that I know are employed pretty regularly. So if we look at bias that can happen within student course evaluation, there's a lot of research. I spent hours just digging through research on this, and I didn't even touch the surface of how much research exists on the area of student evaluation bias. I've included here a list, and I'll talk a little more in depth about some of these issues as we go through. Obviously, when we're asking a student to give their opinion on a course, we're setting ourselves up for some bias in the way that they answer. And some of the biases that research has kind of proven or given us evidence for are that perhaps student evaluations don't really get to the bottom of student learning. They might be more of a popularity contest than an actual learning assessment. In other words, did they like the style of the professor? Is the professor entertaining rather than the actual conceptual information that the student should take in the course? So research has shown, at least in general, that the most entertaining professors are often rated the highest. This includes those with good senses of humor, those who make their classes more entertaining. Also, research has indicated in general that professors who grade more easily or are known to give higher assessment grades at the end of the course tend to be rated higher. Therefore, professors that have more challenging material or maybe are presenting things in a way that really challenges students, perhaps that might be reflected in the evaluation. Also, the popularity of the subject matter. And I even experienced this in my own college because I teach in an area where sometimes students have a passion for pediatrics, for instance, and sometimes they want nothing to do with learning pediatrics, but it's part of the curriculum and they're forced to take the course. So subject matter that is popular with students or that triggers their interest, there's a correlation research-wise to evaluation of faculty that teach that subject matter. There's also this distinction for race and cultural bias. There's not a ton on this, we're getting more and more evidence as we go, but in general, there seems to be a negative trend toward evaluating those who have a different race or culture than students. And this can be a very horrible thing as a faculty member who's evaluated based on something that should have no input for students on how they rate their faculty. And gender bias. Gender bias is a big one. There's probably the most research on this topic of any that I've found. We know that female and male faculty are rated differently, as well as those with gender and sexual identity differences are rated lower. So this is again, a disturbing trend and one that is unfortunate. And I'll talk a little bit more in detail about what research shows us in this regard in a minute. And then age-based bias. So faculty who are younger might, according to research, have a bias against them as less knowledgeable than more senior faculty. And then it can also work in reverse in terms of faculty that are of extended age and maybe are viewed as too old or shouldn't be teaching anymore. So there seems to be this zone of age that tends to lead to higher evaluation scores. Whether classes required. Classes that are required by the program, but maybe are not as of interest to students might be rated more poorly in general, as well as classes that are not required, and a student takes that class because they have an interest in the class, we see evaluations rise. So it's of course correlated to the student's general interest in the topic and whether they feel it's money well spent in their on their benefits. And then finally, the grade a student expects to receive in the course can impact evaluation. What we mean by this in research is that students who are at the end of the course and are evaluating the course and feel like they performed well and they're going to get an A or a very high grade will tend to evaluate the course more highly than a student who is worried about their grade or fears failure. And so that can impact the assessment at the end as well. So lots of biases again that could play into this. So our job is to figure out, despite all of these issues that can happen, how do we get the most accurate evaluation from our students? How do we still gain useful information that can help us customize and direct our course to make it better? Because ultimately we do want to do that from our student evaluation. So here are some studies that I found. I highlighted only a few. Again, there's thousands out there. But these are studies that look specifically at gender bias. And there was a study by Sprague and Masoni in 2005 that looked at the way students evaluated their instructors based on the way they described them in subjective words. So wherever there was an open-ended question about the faculty member, they would take those subjective statements, and pull out keywords. So they looked at males versus female instructors, and they found a lot of statements regarding a male's personality characteristics. Things like funny, enjoyable, entertaining, and so on. And then they looked at female descriptions, and they found words like nurturing, caring. And so they were able to deduce from the way that these words were used that women have to engage in more time-demanding forms of pedagogy in order to garner the same global teaching ratings as men who teach according to conventional gender expectations. In other words, their study found that females have to spend more time being nurturing, caring, understanding in order to achieve the same ratings as males who may not have those characteristics. McNeil et al. In 2014 found that, and this was a very fascinating study, they put students in a course online and they divided the students into two groups. One that thought that they had a male faculty member leading the course and one that thought they had a female faculty member leading the course. And so the students were blinded to the reality of whether it really was a male or female, but it was the same person interacting with both groups. And then they looked at student evaluations and expectations based on the gender of the faculty that they thought was leading the course. And what they found was that regardless of the actual gender or the performance of the students in the course, students rated the perceived female instructor significantly more harshly than the perceived male instructor. And again, these were the exact same interactions for both groups. So that's fascinating. And then finally, Mengel et al. In 2017, they looked at women, particularly younger women or female faculty, and they found that the younger women received poor student evaluations, even if they separated out the students' study time, work in the course, the final grade. Despite every other factor, the younger females were scored lower. Let's look a little bit at some research that found bias against faculty of color. DiPietro and Fay in 2005 looked at faculty of color compared to white faculty and found that Hispanic faculty in this particular study received the lowest course evaluation. Second lowest were Asian American faculty, but every group that they looked at was rated significantly lower than white faculty. Smith in 2007 looked at two groups, Black faculty and white faculty, and then a third group they called other, which was every other racial or ethnicity within the study. And what they found is that Black faculty were rated lowest compared to white and compared to the other category within their study. Storage, Horn, Cynthian, and Leslie in 2016, they took the Rate My Professor online site and they did a word search looking at the words brilliant, genius, and a few other terms representing kind of greatness within faculty. And what they found, again, was that the evaluations were significantly lower for African American faculty, and the use of the word brilliant and genius were much, much less common. Other biases within research, correlation with personality and humor, entertaining and funny faculty were in general rated higher, and this is a summary of the research that I looked at rather than one specific study. Correlation with course demand and perceived difficulty, easier courses are pretty consistently rated higher by students. Correlation with anticipated grade, evaluations tend to be higher with a higher predicted final grade. And correlation with whether the subject is required or pertains to their major. Courses viewed as relevant to their degree were rated higher. And there's also an interplay with the perception of difficulty within a course. So what does all of that tell us? Well, it tells us we know that there's obvious biases that exist in the current course evaluation system. We know we can't totally avoid that. Unfortunately, it's human nature to some extent. However, if we can find a way to change our evaluation system to be more objective and less subjective, maybe we can eliminate some of that or at least reduce it to a point where evaluations are more usable for all of us. And so that's the idea behind the Student Knowledge Survey. The Student Knowledge Survey is a more objective method of course evaluation that allows the students to self-reflect on their own learning. The idea is that it takes the faculty member out of the equation, and it looks at the way students improve learning from the beginning of the course to the end of the course. When there are no direct questions asked about the faculty, but the questions are centered around the learning, then we've removed some of the subjectivity from the evaluation process. So the idea is the student knowledge survey measures knowledge base. It's the students' perceptions or perspectives on themselves, on their own learning, on their learning process. It removes the professor from direct evaluation, as I mentioned, even though indirectly, yes, the teaching of the professor is evaluated, but it's looked at through the lens of learning and not the lens of entertainment, personality, and so on. It also looks at the course, concept, lab, or event individually. So you could use a student knowledge survey at the course level, from the beginning of the course and the end of the course. You could use it on a particular concept. You could say, today we're going to introduce this particular concept. At the beginning of class, take this short knowledge survey. Let's take it again at the end of class and let's see how much knowledge you feel you gained on that concept. It could be used on a lab by lab basis or a section of lab content. It could be used for an event. I used a knowledge survey for a workshop that I held in clinic where we were examining patients, and the students were able to look at their pre-event knowledge, their post-event knowledge, and look at the difference there. So it can be used in so many ways, and that's one of the beauties of this tool. It can be very brief, it can be more extensive, you can really customize it to meet your needs depending on the situation. So the knowledge survey is a sequence of numbered questions that center around your learning objectives for the course, lab, clinic, and so on. I'll show you very specifically what I mean by this, but in my opinion, one of the easiest ways to get started with a knowledge survey is to take your course outcomes from your syllabus and just dump them into a knowledge survey. At the beginning of the course and at the end of the course, the students are then reflecting on each course outcome and how much they feel they improved in knowledge. A knowledge survey is typically set up in one of two ways. If you look at most of the research on these early knowledge surveys, they were on a 3-point scale. So A, B, C are often used instead of 1, 2, 3. I think that was used, just my opinion, but I believe A, B, and C were used instead of 1, 2, 3 because it's a little bit less, it feels a little bit less numerical and therefore less statistical versus just feelings and how they rate themselves in terms of their knowledge. So that can be a really a nice scale to use. A represented also a number 3, which the students don't need to know, but on your end, A represents 3, which is confidence that you can sufficiently perform the procedure or interpret the result, or your confidence in knowing that particular course outcome. Number 2, or B, is that you are 50% confident that you can sufficiently perform the procedure or know the course outcome or interpret results if it's clinical. And 1, or C, is that you are not at all confident you can sufficiently perform the procedure or interpret the results. Now, with a 3-point scale, it doesn't allow a lot of flexibility for students. And so I started out with my knowledge surveys using the 3-point scale. And what I found is that my students, who probably, yes, are a little bit more type A than most students, admittedly, but my students were asking me, well, can I do A.5? Can I do, I don't feel like I have a good option here. I'm not quite the A, but I'm better than B. And so I was getting a lot of those types of responses from students. And so I decided on my own that I would go ahead and change to a 5-point scale. And that seems to suit my students. They appreciate that, and they tend to not give me the same complaints I had before. So on a 5-point scale, for each course outcome, I ask the student if they are 1, not at all confident, 2, confident 25% of the time, 3, confident 50% of the time, 4, confident 75% of the time, or 5, 100% confident all of the time that I could perform this course outcome. And again, that scale seems to work pretty well for me, but you can certainly customize this to your own needs within your course. So this is what the cover of my knowledge survey looks like. This is the one that I just gave the spring semester to my low vision course. And you can read here, but it says the purpose of the survey is to help you assess your learning progress and comfort with the examination of patients with vision impairment and overall knowledge about low vision rehabilitation. This is not a test and will not impact your course grade in any way. And if you read the research on knowledge surveys, they're very vocal about the fact that the students need to understand that it's not an assessment per se, it's not an exam. This is their own self-reflection. It doesn't impact their grade and so on. So that's a really important piece to put on your cover. Your participation is voluntary. That's another piece. I hesitated to put that because I wanted every student to complete it. However, I felt personally that by making it voluntary, those that completed it would feel comfortable doing so. And those that chose not to complete it, I don't want a penalty of any sort, so I wasn't going to force that issue. In my classes, I give it to them on pencil paper because, and I'll talk about this in a bit, that was the way to get the best response rate. And 100% of my students usually complete it. So for me, it's not a problem. You can choose whether or not you want it to be voluntary, but that was my decision. Your name is being collected only for purposes of comparing your survey scores with your course performance and will be detached from the data when analysis begins. I did an actual study and got IRB approval to look at this particular use of a tool in terms of a knowledge survey. And so for my study, I looked at student grades and I looked at whether a student received, let's say, an A, and whether those students rated themselves with 5 on the 5-point scale on most course outcomes to see if there was a correlation between what students thought that they learned and their performance in the course. So I had that in there initially because of that. Now we are allowed to collect that information as course coordinators, but we can't publish or share it beyond our courses without IRB approval. And that's why I went through IRB so that I could take that study to the next level and perhaps eventually publish. And then I asked for the student's name, and then there's a line for participant number. The participant number line was because I gave them a randomized number, and I put that number on both the cover sheet and the survey so that I could detach them without a name to the data when I'm going through evaluation. That was important to me because I didn't really want to know who was who. I just wanted to look at the overall numbers. And that created anonymity for the students to some extent, especially when I was in the IRB process. So this is what the knowledge survey looks like. And I have 13 course outcomes. I've numbered them here as item numbers 1 through 13. At the top of the knowledge survey, there's the scale that says, 1 is a not at all confident, 5 is confident 100% of the time, and everything in between. And on the very first day of class, before I begin any instruction, I hand them the knowledge survey. Again, they're numerically numbered in the top corner, so I know that the name's not going to be attached in the end. And they rate themselves in the pre-course column 1 through 5 on each course outcome. It takes about 5 minutes, so it's very quick. In one of my courses, I tried to do this using Excel, and because I really would like to avoid the pencil paper idea as much as possible. And when we were online for COVID, I tried it online. And as you would expect, response rates drop as soon as you put something online. And so I have returned to pencil paper, even though I have to manually go in and enter all the scores myself later. I did find that if I gave them an Excel spreadsheet option and they could pull it up on their laptop right in class and fill it out right then, my response rate was decent. But I even had students make it look as though they were filling it out with their computers open and not actually doing anything, just because it was on a computer instead of pencil and paper, which I found very interesting. So I have, just for my own knowledge and clarity, I have gone back to pencil paper, but you could certainly do that in a spreadsheet if you like. When I was doing my research on this, I also added in, this is something you might consider, a confidence scale rating. This is a standardized test for evaluation of self-confidence. And the reason that I decided to add this to my research is that I was curious if a student is a very, very self-assured and self-confident, are they going to rate themselves higher with their learning than if they are more humble, a little more doubtful of their own knowledge and skills? How would that impact my findings? Now, theoretically, I thought if a student is very highly self-confident, that would impact both their pre-course and post-course scores, not one or the other, but both equally. That was, again, my assumption. I'm still analyzing all of my data, and I don't have results to share with you yet. But that's the point of the knowledge of the confidence scale, is to see how does their self-confidence impact their final grade, and as well as their knowledge rating of themselves. This is an example, just a randomized sample of what the printouts can look like. So in this particular knowledge survey, I had 25 items, and students were anonymized by number, 1 through 30, 36 or 38, whatever I had that year. And the pre and post scores for each student was placed in a column. And so I'll show you how I used this data just in a moment. So some things that I did to implement this, I provided class time at the beginning of the course. And like I said, it's about 5 minutes, sometimes 10, if it's a longer survey. I provided the same amount of time at the end of the course. I waffled a little bit over the years in terms of how or when to administer the post-course survey, because I like to do it before the final exam because I have them there, captive audience, they haven't taken the final yet. It's quick and easy to get it accomplished, but then they can't reflect on the final exam because they've had it before that. So then I started doing it as they turned in their final exam. I hand them their knowledge survey. They go back to their seat, complete it, and then leave the class. And so I've tried it both ways. I haven't particularly found a massive difference, but that's something you can consider. I instruct them on the importance of honesty and introspection, that I really want to know how they really feel about things. I want their honest self-reflection. I complete the course, and then I provide that time again at the course conclusion using the same form. Here's another debate I've had with myself on this. Do I want them to see their pre-course ratings when they're completing their post-course ratings? In the end, I have decided yes, that I want them to be able to reflect back on how they rated themselves at the beginning to place that final number. I've often thought, what if I don't give them that information? Will that change how they rate themselves post-course if they don't remember how they rated themselves pre-course? And I don't have an answer to that yet, but that's also something you can think about and consider. Some hints about this. It's really important to me that I introduce this as important to the learning process because it allows the student to self-reflect. It's also important to me because it gives me a sense for how I'm doing on each of my course outcomes. And I'll talk about specific examples of that, but the questions need to be quite specific, but not so specific that you have 100 different outcomes that you're trying to assess. So there's a fine line, and I have found course outcomes to be a good indicator of that for me. The question is, what do you really want them to understand as they leave the course? What are the take-home points that you want them to gain? And those should be what you make your questions for the knowledge survey. Also, questions involving the application of knowledge to a patient or situation. In a clinical environment or in a practical experiential learning type of environment, you can customize the questions to what you want the student to gain from a particular internship, interaction, or so on. And so I think it's very customizable that way. I also tell them no pluses or minuses. They have to pick a number. And that was because, as I mentioned, I was getting students who were writing minus and plus next to answers, and I didn't know how to interpret that. So those are some hints that I have found are helpful as I implemented the knowledge survey. So interpreting the data, what do you do with the information once you get it from the knowledge survey? Well, what I like to do is I like to plot the student answers pre and post for each question. And I usually just use a simple Excel spreadsheet because I am not a statistician, not my strength. I don't like stats. I want to keep it to a minimum, but I do use an Excel spreadsheet. I plot the pre-scores per student and per question. And then I have a final category for all students combined on that particular question. So an average score for all students. I also have looked at this from a non-student perspective, and I've looked at it per course outcome. And I've also looked at it overall. If you take all of the course outcomes and combine them together and average them, how am I doing? So there's a lot of ways you can slice and dice the data here and get out of it what you want. I like to set goals for my improvement from pre to post course in advance. So for me, I like at least a 20% knowledge gain pre-course to post-course on the 5-point scale. So I want them to go up at least one number. I could make that goal higher and say I want a 40% increase, but I set that goal ahead of time. And then I analyze by question for the class from pre to post-course. I also analyze by student, not necessarily every student individually, but the overall average of the students, pre to post course on each question and overall. And then I like to graph it to give myself a visual representation of the data. So this is just an example of how it might look. This was when I was using a 3-point scale. So you can see the 1 to 3 on the far left there. And the outcome, the course outcome by question, and this one I had 31 outcomes I was measuring. This was in my early days as I was refining this process. You can see the pre-average is in light blue and the post-course average is in red. So I like to look at it graphically and say, okay, number one, what outcomes did I do a good job with? You know, they started out with low knowledge. They improved significantly. That means that hopefully that I was able to convey that knowledge to them, and they do well with it now. But I also asked myself, in areas where I didn't improve much, why? Is it because they came in with a lot of knowledge already? An example is number 9. In number 9, you can see the blue graph there is already quite high coming in. So then I asked myself, why? Is it because they've already had this in other courses? Maybe I don't need to spend as much time on it. Maybe I can reduce its emphasis in my course. What if I don't get a lot of gain, even though they come in with low knowledge? Then that's an area I need to fix. I need to go back and figure out, what am I doing wrong? How can I make that area of teaching more effective? This is another way that I can graph it to look at the numbers. This one is based on student number instead of outcome. So you can see now, I've got the 3-point scale along the left side. I've got student number along the bottom, random, again, anonymous student number. And then my number 30 is all students combined, so student average. And then I can look at, for each student overall, how did they improve? And why would some students improve more than others? And how can I address that within my course? Here's another example of a graph that I've used. This is a 5-point scale now. When I switch to that, you can see average pre-knowledge and average post. Again, 26 items on this one on the 5-point scale. And so I can look at item number 1 and say, wow, they already know quite a bit about this. I'll reduce that amount of time within my course. Maybe I need to improve on this particular outcome. So in terms of statistics, if you want more than just a % improvement, you can also do a parity test statistically and look at your improvement through the course that way from a more statistical standpoint. And for me, I did this when I was doing my research, and I was finding that I had a P less than 0, so pretty much everything. In other words, I felt good about the fact that I was making significant improvement on every outcome, some more than others, but this was a great way for me to kind of prove to myself that I was doing okay. All right, so result interpretation pre-course. So I looked at whether there are students or areas where the students rated their confidence high coming into the course. Do I need to spend less time on those areas? Or are they overestimating their own knowledge about something because they've had it before? And I often found that was the case, where I'd have students rating themselves quite high in an area, but they'd come to me at the end of the course and they look back and they say, wow, I gave myself a 4 out of 5 at the beginning of the course, but now that I've had the course, I realize that shouldn't have been a 4. Can I change it? And that created another dilemma for me. So I ended up allowing them to change it because they're looking back. But you can do that however you like in terms of your philosophy on that. Are there areas where they should have more knowledge coming in, but they don't? So I'm in a step-by-step curriculum. So if there's an area where I expect them to have good knowledge coming in and they're all giving themselves 1, then I can look from a curriculum standpoint and say, maybe we're not hitting this as much as we should in courses prior to this one. And I can bring that knowledge to my colleagues and we can work together on trying to build up that particular area of curricular deficiency. At the end of the course, as I'm looking through this, I say, did my students meet the goal I set? If I wanted 20% improvement, for instance, did I get that on every outcome? If I didn't, why? What can I do better? If not, do I know why? How do I improve my teaching on this content? If so, if I did meet my goal, does my goal need to be higher? Is 20% a realistic goal? Should I go for 30? Should I go for 40% average? What do I feel is best for my students and for my teaching? Where should I set that goal? How do I emulate my methods on outcomes with massive improvement and the outcomes with less improvement? What I have found is that if I reflect back on outcomes where I've had poor improvement, I might be able to implement a more hands-on learning tool within that particular outcome. So I might be able to say, well, if I had implemented a case-based assignment on this content, would it have been higher? And then I can try that out and see if it improves the next year. Was there an assignment, case, or activity that led to increased knowledge gain? So it's really nice to reflect back and look at what I did specifically on each outcome and whether it was effective in terms of improving outcomes. Okay, so that's the content. I wanted to share that idea with you. And I would love to hear from you, what course would you think about implementing this within that you teach? How might you use a knowledge survey in your courses, labs, clinics, events, workshops, and so on? Can you turn your course outcomes into knowledge survey questions? And if not, why not? Maybe that's an indicator that you could improve your outcomes, perhaps. Any other questions or ideas? This has certainly been a learning process for me, and I'm not perfect at it at all. But I have found the beauty of this is that I don't get comments like, why does your class have to be at 8 a.m.? Rather than looking at true knowledge gains, which is really what evaluation should be about anyway. So it has been a good tool for me. So we have 10 minutes or so if anyone has questions or wants to discuss this further, both Zoom wise and in person. Let me know. And this is my contact info. If you want to reach out to me later with any questions, by email, phone, feel free to do that. I do have a bibliography of some articles that I pulled, but I'm sure you can find your own as well.
Yeah, I don't really have a question, but I love the idea of and I don't teach a lot of classes where there's prereqs,
Right.
just to show what they've learned. To me, that's a great point of, they already know all this stuff. I don't need to devote so much time and energy, which you brought up, and I just, as an educator, even as a student, they're gonna be bored, right? So they're
Right.
going over stuff.
Right.
So I think that was a really interesting point, that if you didn't do this type of survey, you would never have found that out.
Right, agreed. I think for me, it was pretty interesting and revealing because there were areas where the students would come in and say to me, I've had this before, you're repeating information, I don't need this again. And then, I would see that reflected in their high initial evaluation. And sometimes, they're absolutely right on. Maybe we are being too repetitive with certain pieces of information, but then there were other areas where I'd look at the post course and I'd still see a huge thing. Or they would come to me and say, can I change my initial number? Because they were recognizing that they didn't know what as much as they thought they did initially. So it's been really fascinating as to how that plays out. And now that we're looking at things from a more college-wide curriculum standpoint too, we have a curriculum committee and we're doing a lot of work at kind of making things more cohesive. I think it's been really helpful.
I was thinking about intercollegiate standoff, if maybe another layer of evaluating this, you compare how they score, so their perception of their learning
Right.
with the actual items tagged for those outcomes,
Yeah.
with the direct assessment methods to see, how
That's a
close
great
are
point.
they?
Right. So with exam soft, those that aren't familiar, we have a computer-based assessment system basically in our college, and our pharmacy uses it as well, and maybe others on campus. But it allows us to, as we're writing exams, to tag each course outcome that should be assessed by that item, and then we can go back later and evaluate: are we hitting everything? How did they perform on certain outcomes? So it's a very handy tool, time-consuming, but it's a very handy tool. So I think, Mandy's idea that we could go back and compare that to these ratings and do they correlate? That would be really interesting to do, and it's a great idea. I haven't even remotely explored that yet, but I appreciate the idea.
I would jump off of that. I've been thinking from the psychology colleague standpoint of the Dunning-Kruger effect
Right.
and how you rate your own knowledge. Like the more you know, the less confident you are in your knowledge.
Yeah.
And I've been thinking about that. And you said I need to change my initial score.
Right.
And it might be a really interesting avenue to research.
Yeah, thank you. And that was actually what was running through my mind when I implemented the confidence scale too, because I was really curious as to how their overall confidence in themselves and just personality, how that played into it. And so that was part of my thinking, but I don't think I got really to the bottom of it as much as I would have liked to with the confidence scale either. That's the question.
I have a question from Dan Winnie.
Uh-huh.
Do you track a change if the student changes their first number?
Do I track the change if the student changes their first number?
Yes.
Is that correct? So yeah, hi Dan. So yes, what I do is I use the new number. However, I make a footnote in my Excel spreadsheet about the change. And then I can go back and reference it later. I suppose you could change your parent test if you're doing that, and do it on both and see how it changes. That'd be interesting. I haven't spent a ton of time on that because thankfully it doesn't happen that often. And so I haven't really found the need to do it frequently, but it's just a tough thing to deal with. I'm not even 100% sure how to deal with it.
All right. So I'm coming at this from a department chair perspective.
Yes.
And obviously the impact of all of the biases that you talked about in evaluations is something I'm very mindful of when I write evaluations.
Right.
I'd like you to maybe think about how this becomes part of that process, because I know there are a lot of concerns of using student outcome achievement to rate the instructor, because there are so many other factors that contribute to how that student achieves the outcomes for the semester, including their own study time, all of those things.
Yeah.
So I guess I'm not quite seeing how one solves the problem of the other.
Yeah.
So I was just hoping you could talk a little bit more.
Yeah, that's a great question. So I don't think this eliminates bias. There's no way it can. I don't think anything we do will, for sure. I think what I have found is that some of the comments that I would get prior about I don't like this course because I don't want to practice pediatrics. Those are sort of removed from the equation to some extent because they're looking at, okay, I don't care about that. In this outcome, did I learn anything? But you're right, it is impacted by study time, by how much they care about the subject matter, because they're going to study more if they care about the subject matter also. So I don't think it eliminates it completely. But I have found, for me, it's a little more objective than, the other types of evaluation. I wonder, in terms of your question, just throwing it out there, and I'd love to hear what you all think. Could you ask students a self-evaluation question about how much time and effort they put into a course and factor that into the assessment? In other words, we're already asking them to self-assess. So could we say, did you give your all of this course? Can you rate your effort?
I think there are questions like that on the
Yeah.
idea already, so.
Right. And so I wonder if that could also pull into it a little bit, and maybe you could somehow data-wise factor that out. I don't know, just throwing it out there. I'm thinking out loud.
Yeah, you got me thinking, one of the first things I wrote down as you're talking is, well, what's the purpose of course evaluation? I think there's a difference of opinion on that,
Sure,
and you're really focusing on the ultimate goal of what is students getting from the course and learning,
Right.
which is different from their perceived satisfaction with the course, the experience on the whole, and so.
Exactly.
And
And
your point about, from a leadership standpoint, and how these are used in evaluation, that it's important to be clear about the different purpose of school.
right. And I think if you look at, all the biases that exist, the question is, how can we reduce those, but still get an accurate reflection of learning and satisfaction too? Because it is important. It's just how do we get to the bottom of that and try to factor out all the other biases to give us an accurate number or assessment. Very interesting. Any other Zoom questions?
There's no more Zoom.
Okay.
Talk about Zoom.
Okay, sounds good. Thank you all for attending, and I'll hang around a bit if anyone wants to chat anymore.
I don't teach or anything, but what I do on campus is I work with professional development. And
Okay.
I get first instructors to do training for industry. So my students are participants, not students. But I do this kind of same thing, evaluation. They evaluate themselves, how they,
Right.
at the beginning of the training to the end.
Yeah.
I wonder if this is something that I could use that way on my end, so I can like see it all. 'Cause it's just paper pencil and I have nothing to put it all together. It's just the pencil and I look at them and stuff. It
Yeah.
would be nice to put it together and see all the results for the training.
I feel like this would be a perfect use of that, because it would be what you're really looking at is knowledge gain, so training or workshop or whatever. And this is great for measuring knowledge. It won't give you as much information as Andy pointed out about individual instructors or how did I like this person. But if that's not what you're going after, then that's perfect.
Yeah, that would be great. That would help out.
Yeah, and I'm not a stats person, but those graphs are really easy to manage to just with Excel. You have a visual for before and after, which I find really helpful versus just looking at the numbers.
Thank you very
Yeah,
much,
you're
because
welcome.
it opened my eyes.
Oh, good. I'm happy to hear that. Hopefully it'll benefit someone. You don't have to.
I been trying for students for influence, and I'd like to get the template possible for, because I want to make sure that, they're getting what they're supposed to. I have just a small, short, quick survey that I need for this. But this is wonderful.
Oh, good. Yeah, good email me. I'll send you my cover page that I put up there. You
Okay.
can customize that how you like. And
Okay.
then, I just made that template in 18.
Okay.
Okay,
That's how we do it, but I can send you mine and you can
okay.
cut
Take
and paste, you know,
Okay.
however you want. And if it's useful for you, so you can try and kind of design it.
Yeah.
I'm all for that.
Okay, thank you.
Yeah, sure.
Well, this is, I'm the program assistant, I don't do NDPL, so, but we do the surveys and we have a question on it, it's all based by the outcomes, but like there's a part on there, how do you feel the instructor did? So I'm interested to see like how we could reframe that piece and that,
Yeah.
because we do get some silly comments as well.
I mean, I have to say overall, I don't. So it's not, didn't want to come across, terrible evaluation. No, no. But you're right. It's heavy.
Yeah,
It's like a little thing, like, one time I did a workshop on just thinking, like, trying lunch. And instead of saying, thank you for lunch, they said, don't put mayonnaise on the sandwich.
Oh, my word.
Oh, wow.
That was a comment I got, and I was like, oh, horrible. I can't believe what it was. So, I know what you mean about the pettiness sometimes. But,
no, it was great information, even to tweak a few things that we have in it currently.
Yeah, thanks for calling.
And we also, I always like to say also, you had this training, what additional would help you do the job.
Yeah, and you can add some.
And that,
some written questions.
that's always nice, but I always try to send all that information to the company, you know, and so that they know. But it would be nice to have everything.
Yeah, agreed. I'll have a one-stop shop. for
Yeah,
that, and all
instead of,
the-
yeah, because, you know, I have how many evaluations, you know, there's only, like, I only have 13 questions.
Yeah,
But still, for if I have 20 kids, you know, you know, it's just better.
right.
And there, that,
Yeah,
That's
there's,
a lot.
there's a lot you can do with it for sure. I think it's just, I'm hoping this is the idea at least, and I'm using that kind of way that you know,
Yeah.
as a motivation.
oh, great. Well, thank you.
Yeah, you're welcome.
There's anything that we can. I'm waiting on Peter for actually.
I know that they. They have one thing to present.
Oh, yeah. Yeah, if you signed up for it, there should be a one.
Oh, this is the one.
Yeah, yeah,
It's in our founders room.
Yep.
so-
I think it's just the box one.